and welcome to a featured demonstration of drchrono, an EMR and EHR software available for both the iPad and iPhone. My name's Caitlin, and I'll be showing you a demonstration of how to schedule a new appointment and also create a new patient chart. We'll go ahead and get started by logging into our drchrono account. Once you've signed on, you'll be able to see your calendar or schedule of appointments. You'll notice that today we have one appointment this afternoon. If you hover over the appointments, you can actually see the details of it as well. For example, this appointment has not been confirmed. You can find the phone number of the patient as well as their chart ID and insurance information. The calendar can be grouped by day, exam room, week, and month. It is a great shortcut for scheduling appointments and also creating new patient profiles or charts, which is what we're going to go over today. So let's say, for example, we have Brittany call into the office and she's complaining of flu-like symptoms. It is flu season and the bug has got her. So she wants to schedule an appointment for Wednesday, December 4th at 1 p.m. There's a couple different ways that you can schedule appointments. You can either click the time slot that the patient's requested, or you can select the New Event tab in the top left-hand corner. Once you've done that, you can start to fill out any information pertaining to the patient and appointment. So for this appointment, we're going to go ahead and classify it as a new patient. Brittany is a new patient. And that will prompt you to fill out any information necessary to create her initial client chart. I'm sorry, not client, but patient chart. So for example, we'll need her first and last name, date of birth, gender, cell phone, and email. Once you filled out that information, you can click Add, and that will automatically add Brittany to your patient roster and automatically create her patient chart. So moving on, we can continue to fill out the information pertaining to the actual appointment, including reason. So Brittany mentioned that she was experiencing flu-like symptoms, and she wanted the appointment scheduled for Wednesday the 4th at 1 p.m. We'll go ahead and allot 30 minutes for the appointment, and we can continue to fill out any other notes that might be helpful or useful to the doctors and staff. So let's say, for example, that Brittany described symptoms like a stuffy nose, fever, and sore throat. You can also choose the office that she'll be scheduled at if there's more than one. You can select an exam room. We'll go ahead and put in exam room 3. You can even color code the appointment. So depending on what you prefer, you can, for example, color coordinate the appointment according to the type of appointment, the type of insurance, the type of patient. So let's say, for example, since Brittany is a new patient, we like to coordinate or color coordinate our patients by the type. So let's say green indicates that she's a new patient, and maybe blue indicates a current. So we'll go ahead and select green. You can also select the status of the appointment. As you can see, you can choose arrived, you can choose the appointment as being in session, complete, confirmed, not confirmed. We'll go ahead and select confirmed since Brittany did call in and schedule the appointment herself. Next, moving on, we can go ahead and choose a reminder profile. So this is how we'll remind Brittany of her appointment. If you remember, we did put in her cell phone and email information, and this is what will be used to send those reminders. So choosing a reminder profile, we don't have any last reminders since she is a new patient, so we'll go ahead and create a new one, which automatically selects email. We'll go ahead and leave it on that. And since it's within the next couple days on Wednesday, we'll go ahead and send a reminder the day before. Once we do that, we can click Save, and the appointment will be saved to the calendar. Also, if you forget to put in any sort of important information for the appointment, Dr. Chrono will notify you of what information is missing. And then once you've had the patient with you for a while, and also depending on the type of Dr. Chrono software that you're using at the time, you can fill out billing information, vitals. This is something that the nurse might do on site once the patient has arrived. Insurance eligibility. You can also create custom fields and so forth. Going back to the appointment, we'll scroll down, hit Save and Close, and that will allow you to update your calendar with the new appointment, as you can see here. Once we've hovered over the appointment, just like we did for John earlier, you can see the information for Brittany's appointment. The provider will be Dr. John. She'll be in exam room 3. You can see that she's experiencing from flu-like symptoms. The status of the appointment is confirmed. You'll have her chart ID number on hand and telephone number. And once we have her insurance information, that will also be provided. So if you'd like to ensure that she was actually added to your patient roster, you can go to the Patients tab and click Patient List. And this will take you to a full list of your patients. Here you'll be able to view their chart ID numbers, their first and last name, their home telephone number, if available, cell phone, their last appointment, their next appointment, and follow-up. Also, this is great because you can see if they have valid insurance as well. So let's go ahead and see if she was actually added. Brittany was added to the list, as you can see here. We'll click on her chart number, and this is where we can find all of her information. So any important information, name, contact information, maybe a photo, the type of language she speaks, medical history consent. You can find her demographics, so perhaps her patient's social security number, gender, race, street address, we want to make sure to put that in since we were notified that we didn't have that. You can also fill in custom demographics, again, depending on the type of account that you have. Any sort of referring doctor if there is one, a responsible party, employer. It simply depends on how much information you'd like to have for each of your patients. So as we wait for the wheel to stop spinning, let's go ahead and scroll back up. You'll notice that you can also find her different insurance, eligibility, if she's eligible, authorizations, and account balance. If she owes any money or if she's paid off a current balance or past balance, you can check on that as well. If you look to the left-hand bar, you can notice that we can keep track of appointments, any sort of documentation, on patient data, problem list, medication list, if you have access to ERX, our electronic prescription service, allergy list, drug interactions, lab orders, immunizations, and medication reconciliation. Their chart can provide all the information needed for patients. Now, as we go through, of course, we're not going to have as much information as we may like for Brittany at the time, but this is all information that can be filled out once she comes in for her appointment. So that is how you create a new appointment and new patient chart on drchrono's system. Please let me know if you have any questions. Otherwise, I do look forward to showing you what other features and benefits drchrono has to offer, and I definitely look forward to that. Again, thanks and have a great night.